Hi, you're watching Talking About. I'm John Griffith. We're continuing our discussions with folks from AIDS Center of Queens County. And in this program, we're going to be discussing education and prevention programs. And just going to quick introduction. I didn't clear any names before we started, so hopefully I get them all right. Just wave and say hi as I call you. Shirley Bierno. Did I say it right?
Bejarano.
Bejarano. Okay. Akio Williams. Juliana Campos. And Alejandro. Sorry.
No, go ahead.
No, give it to me, please, because I'm just going to.
Almeida.
Sorry about that. Just forgive my humanness.
No worries.
Okay, so just sort of an overview to get started. Yeah, education and prevention can be quite encompassing. So what's the basic overview of that? Shirley.
Oh, yes. So first I want to tell you, John, thank you so much for having us on here. And I apologize for the background noise. Let me get out my emails. In the office, you might hear some background noise, so I apologize ahead of time. Yeah, so the Education and Prevention Department, overall, it's exactly what it says. We educate about HIV prevention and STI prevention, and we prevent. In the way of the prevention, you have to have both. They complement each other in order to actually see a difference. So by the educate what's the importance, why should I protect myself, or why should I take any of these precaution measures to prevent from HIV or STIs? And then once they have taken those precautions, and part of that precautions is also getting tested. So that is one of the main services that we offer in the education department, and the most crucial. And all the services are free.
Okay, that's great. As someone who came of age when things were a lot more deadly than they are now. I mean, it's still a serious matter, but it's not. It was considered a matter of death and life, and now it's more surviving and staying healthy for most people. So that expresses some of the progress that's been made along the way, but it's still not something to take lightly, and it's still not a one-size-fits-all form of, in the eye of prevention. Yeah, there are many more methods out there, and yeah. Everybody, in my opinion, needs to be informed and take responsible for their own sexual health and well-being. And the education and information aspect of it is a wonderful service that many people don't realize is out there. A young person is just starting to realize who they are, and they want to make sure to stay informed, and just the beginnings of becoming educated and informed. Yeah, they reach out to ACQC. So what's their first step for the youth tack on it?
Yeah, so I'm glad you asked that question in specific. You know, we most of the time we tend to just focus on the adults, and also assume that you know, because we're maybe interacting more with adults, everyone knows, oh, you have to use a condom. Oh, you know, you shouldn't, you know, take all these precaution measures of maybe lowering the number of partners, or you do other things. But these basic and automatic prevention methods that adults usually take into consideration, some forget that these basic instincts that have become basic instincts for adults, the youth, the children don't know about these things. And we need to go back to the good old education about condom use, about just healthy relationships, how to make healthy, make healthy decision-making, measures. And so we have the perfect people here to talk about exactly that. And if it's okay, we can, if I would like to, or if I could send the question to Juliana to first start, because she is works in two of the programs that we have here, and IKEA as well. So with Juliana, her programs are in the schools and also working with high-risk youth here at our youth drop-in center. So if I can send it over to Juliana, and you could please get a little bit more in depth in your programs.
Absolutely, please.
Okay, sure. Well, I'm Juliana. I'm a health educator here at ACQC for the CAP program. And CAP stands for Comprehensive Adolescent Pregnancy Prevention Program. It's quite a mouthful, right? But what we do is, as Shirley mentioned, we try to, I wouldn't say try, what we actually do is we normalize sex and pleasure in sex education, while we are also incorporating the less fun parts of teaching sex to kids, or such as STIs, unplanned pregnancy, and things like that. And as we have already mentioned, it does start with prevention, right? So the work that we do in high schools, in after-school programs, is really teaching youth how to become responsible, how to enjoy sex while being responsible, while taking measurements to protect their health and the health of their partners as well. We also have the YDC, the Youth Drop-In Center here at ACQC Woodside. We have services for adolescents and young adults aged anywhere between 13 to 24. Who are homeless or at risk of becoming homeless. So we service them with emergency hot food, for instance. We can also offer shelter placement. We are equipped with shower and toiletries and hygiene kits. It's also a safe place for LGBTQ plus youth to come and hang out. They can come do homework, they can use our computer labs, they can get a snack, they can charge their phones. So it's a safe place where they can come, participate in our workshops, learn about how to lead a healthy sex life, and get services as well.
Right, there seems to be a tremendous social aspect to it all, which makes it much more appealing as well. With regard to people coming of age and just the amount of self-discovery, I'm assuming IKEA, that's kind of where you come in with being a counselor and providing the additional support as needed.
Yes, so I'm the health educator here at the Jamaica location, and I predominantly work with the youth out in Far Rockaway, ages 13 to 21. So I've worked with they have a teen center out there, and we partnered with Shelter in Arms for the last 2 years, so that's been really great. They offer a lot of the services, as Juliana explained. Shelter in Arms does offer shelters, shelter assistance for those who are in need, if they need food pantry, if they need clothing, things of that nature. So where I come in is mainly just supporting with education in the support groups. So what my focus is of course we're doing sexual health education. That's the main thing. But the way that I've done it is focusing more so on the core values. So assessing what the youth's basic understanding is of sexual health, right? Because we may assume that they know what that means, but what is their understanding of it and how do they apply it in their lives or not? Right? So what have you been doing so far? Like, do you know how to use a condom, right? So of course we do condom demonstrations. We explain to them the different types of condoms. For example, flavor condoms or oral condoms are only for oral sex, not for intercourse. And here's some reasons why, things to that nature. So pretty much just meeting them where they're at and then educating them with STIs, STDs, making sure that you are regularly going to the doctor, especially for females, making sure you're going to the GYN, things of that nature. So it's not just necessarily teaching them about sex and having safe sex, but also communication, right? How do you communicate with your partner what you like or you don't like, or what you're comfortable with or what you're not comfortable with, right? If you want to use a condom but your partner may not want to, how to do condom negotiation skills, stuff like that. So tying all of those things together, so it's not just focused on, hey, let's have sex, but also just how to be comfortable with just having a basic conversation around it. So yeah, that's pretty much where I come in.
Okay. Alejandro, does the approach change among more diverse communities?
Well, it does. It does. I think like every person that step into our agency per se, it comes with different situations and regardless of the ages, because my program focuses on 18 and older. So 18 to we have a program that's 18 to 29 and then 18 and up. So yes, everybody, like, it's different. And when, like, adults also, there's a lot of misinformation and there's a lot of miseducation. So we think adults, since we are adults, we know things, but sometimes we're not. So it's kind of, you have to go back and, as Shirley mentioned, educate them again and refresh their memories, because maybe the information they received is from like 20 years ago or 5 years ago, and we're in a date and time that things changes tremendously. So yeah, I will say that every person that step into our offices receives somehow new information and they get educated.
Mm-hmm. Well, even through the conversations that we've been doing on air between myself and other departments of ACQC, I've always come out a little bit more informed than when I went in, and that's something that I'm very grateful for, just for my own self.
Yes, and another thing is, like, when you educate a person, this person is gonna go out there and he will tell a friend, a family member, hey, I went to this agency and they told me this, and that. So, they spread the word and the information as well.
Okay. So somebody's sort of, come along and they have the baseline information and they're getting ready to go out and take the next step in a relationship, or even if somebody's on an app and just wants a hookup, for lack of a better phrase. You can help them to see that they're armed with the right information and the right supplies as well, because it's I came of age when I came of age when it was abstinence or condom/dental dam, and now there are other options, including PrEP, HEP, and the like. So somebody's getting ready to take that next step, and they're open about it enough to come in and ask the right questions. What kind of questions are being asked, and how are they guided?
So when a person comes in, usually they open up to us. They see us as that person that they can sit and talk to with no filter. That's one thing. And as you mentioned before, there used to be only condoms and dental dents. Now we have PrEP and PEP, and there's and people are taking that more into consideration when it comes to move to the next step in a relationship, which is condomless sex. And they come with a lot of questions, like, what are the side effects of it? Does it cost me money? How can I get it? Is this a confidential procedure? And there are also a lot of stigma about PrEP and PEP, because sometimes, especially in the LGBTQ plus community, people think that you're taking PrEP as a way, like, you being taking PrEP allows you to have sex with as many partners as you can have or want. And sometimes it's not the case. It's just a prevention method.
Mm-hmm. Yeah, I've talked with people, and there is I see it on the decline, but there is a bit of slut shaming that comes with
Yes,
the concept of
definitely.
PrEP. And yeah, that's yeah. Be who you are and be what you want to be what you want to be to the best of your ability, but go armed with the right information to protect yourself and your partners. Period.
Yes.
At least that's my point of view.
Yes, exactly. And you know, in order to get PrEP, you have to, the first step is getting tested and make sure you're HIV negative. So once we have that proof that you're HIV negative, so we will send you to another program who is in charge of PrEP and PEP, and they will take care from there. And any other question that I can no longer answer, so they can, you know, they're fully prepared to answer all those questions for sure, and provide an outstanding service to our clients.
Right. I mean, a lot of what we're talking about is focused on HIV, but there are still other STIs out there that should be taken into consideration. Yeah, PEP and PrEP do not prevent a lot of those. Yeah, PEP and PrEP used with a condom is much more effective in dealing with other STIs.
Yeah.
If I could interject really quick, I just wanted to, because since this will be shown to a variety of public, if maybe Alejandro, could you explain exactly what is PrEP and PEP for someone who doesn't know what it is?
Okay, so PrEP, it's pre-exposure prophylaxis. It's a pill that you will take every day, and it will prevent you from getting HIV. Now, you mentioned, John, that it doesn't prevent you from getting STIs, which is right. PrEP, it's only for preventing you from HIV. And basically what it does is it will create a barrier, so when the virus comes into your body, it won't multiply and it will die out. And PEP, PEP, it's a post-exposure prophylaxis, which means that a person had unprotected sex, went out, got some drinks, and woke up in a place and didn't know what happened. Maybe rape, you know. So they can go to any emergency room, any agency, and ask for PEP, and you will take this medication, which is antiretrovirals, for 28 days, and after that, you get tested again to make sure that you're HIV negative. And one thing that I want to point out is that you have to be very consistent with taking that medication for 28 days. Mm-hmm. It's like priority. You need to take this medication for those 28 days, and then you will see the result. If you were in contact with the virus, this treatment will stop the virus from multiplying, and then you will get a negative result most of the time.
Okay, well, that has to take a mental toll as well. So, is there a little bit of hand-holding that's available if somebody is in a PEP situation?
Actually, yes. There's always that post-counseling, which is after the person. We always we're on top of the person. Like, say they come in for PEP, and we just provide the services, and we don't let them go like that. We're constantly calling them, making sure they're okay. They can always come back to us and talk in case they need to. And yeah, we just don't give them the medication and okay, you're good to go. No, we always keep them on track to see how they're doing, what's going on, if they have any concern, if they have side effects, mm-hmm. which is usually something really throw people off the treatment.
Okay.
Because if they have a lot, I mean, they may have some side effects. But yeah, we keep on track of this person for a while.
Okay, that's good. I know that I always, when it comes up in conversation, I tell people, it's like, I knew I knew everything until I was about 30, and then I realized that I didn't know anything. For I guess IKEA, for the young person who comes in and knows everything, how did they learn that they? How can you safely guide them to a fact that they don't know as much as they think they know?
Well, back to the point where Alejandro said, information is constantly changing, right? So there may be some things that they thought they knew, and then as we're having the workshops, I typically let the youth guide it for the most part, because I always like to see what they understand and what they know. And then if they do say something that is incorrect as far as statistically, statistics and facts, then I'll guide them and say, well, actually, this is what this is, right? And then they'll say, oh, okay, I didn't know that. So I don't want them to feel like they're wrong because they were informed, they just were misinformed. So just kind of letting them know, what the facts are, and then taking it from there. Because a lot of them do think that they know everything. they do think they know everything. So just kind of just letting them know, like, that's not what it is.
Yeah, I find that in under 30 and over 50, those are the two groups that think they know everything, and then it's like you're learning in the middle.
Absolutely. And a lot of times they teach me things too, so I don't always walk in, pretending as if I know everything. But as far as like the facts around, certain STIs and stuff like that, those are the things that I would like, make sure that they know. Especially with the guys are a lot less informed than our female youth, so just kind of, guiding them with that.
Yeah, that's probably a societal influence. Yeah, it's like you guys learn more from their buddies than they do from the professionals and girls.
Exactly.
To make a broad generalization, actually try to access the facts.
Right. So yeah.
So with regard to outreach, I think Juliana, I see you online doing a lot of online work. But how, in the current changing world, how does online outreach play an even more pivotal role, right? Especially right now.
We had very big plans for 2020. We were super excited. We, along with CDC, Alejandro's program, we had put together a folder with information about the services that ACQC offer. We had a schedule. We were going to high schools. We were going to after-school programs. We were going to libraries. We were scheduled to do our Be Proud, Be Responsible workshop in 2 different locations. And then Corona hit us. It wasn't easy. We had to adjust to working from home. We had to make sure that we were still servicing youth, right? Because regardless of what was happening, they still needed our guidance. They still needed our help. And that's when we turned to social media. So Jamie Cooper, who is also one of our health educators, took in as her project to take care of our Instagram account. That's at ACQC Youth. And she hosts every week one live, and they talk about different things such as social justice to sexual health. And then I took on Facebook. So now we have a Facebook page as well, and we share the content that's posted on Instagram. We also post it on Facebook in attempts to keep on reaching out to youth and also now parents on Facebook, making sure that everyone is well informed and know about ACQC.
Okay, that's great. I mean, we've spent a lot of time focusing on youth here, but another area that these conversations reminded me is that the senior community is also largely at risk because of misinformation that they've had all along. And I know there's one over 55 community in Florida that's supposedly the STI capital of the U.S. And surprise, surprise, the seniors are doing what they do. So, is there a different tack to outreach to adults through the senior community?
I don't work directly with the senior community, but I believe that a healthy approach is pretty much what IKEA mentioned. They were informed, right? They were just misinformed. Mm-hmm. So coming to them and explaining that it's great, you're still getting it on, you're still doing your thing, that's fantastic, but there are healthier ways that you can keep on doing so. right? So perhaps when they were younger, other types of prevention were taught. So perhaps take the opportunity now and say, hey guys, 2020, we have new ways of preventing STIs. We have perhaps better quality condoms, perhaps better technique on putting a condom on. So let's take the opportunity and re-educate them.
Mm-hmm. Is there any specific outreach to or differences in education to special needs community? Because people with disabilities, both physical and mental, still have human needs. And I used to do some work with the autistic community, and one of the directors there said, if you demonstrate the banana on a cucumber and say that that's what you have to do to be safe, somebody with a mental disability might interpret that literally, and before they're getting ready to be with their partner, they go and they put the condom on literally on the cucumber and think that they're being safe. So is there a different approach and a different tack that is addressed?
Absolutely, absolutely. There are specific trainings that we would take in order to be able to communicate in a more in a better way with this community, specifically the autistic community.
Mm-hmm.
And as you mentioned, we do have to use a different vocabulary, especially when you're working with adults who are autistic and they still need this human need. They still need to have intercourse. They are romantically or sexually interested in their partners, and rightfully so. They need a right. They have all the rights to do so. But you do have to use a different language. You do have to perhaps lower the amount of people participating in a session so that you can, communicate better, more clearer than if you were in a high school setting, for instance, where you have a lot more people in a class. There are definitely ways to do so.
So passing through the education area, to say we talked about PEP a little bit, but just essential testing. Somebody calls in, makes an appointment. What's the process to helping people get tested or testing on site? How do people go about reaching out for that? Shirley.
Sure. So as before, we would have walk-ins Monday through Friday. Anyone could come into any of our main 3 locations in Woodside, Jamaica, and Far Rockaway and get a test and know the results within 1 minute. Now, the new protocol is people can still come in, we have to do it by appointment. So it's not technically whenever. And we're trying to have everyone just be, not have so many people come in at once. And so that's how we're keeping everyone safe, but still we are open through 9 to 4 every day. And you can just make an appointment very easily. You come in and you get your results within 1 minute. Then of course, probably it will at the end be about 10 minutes in total because of paperwork and other risk assessments that we have to take and information from each client. But within that counseling, we talk about their risk behaviors that they report to us, talk about what are some other prevention that they could, or preventative methods that they could do, like PrEP or PEP. If we identify that there is they've been at risk, then we would recommend, okay, maybe we need to get you onto PEP right away. It's a very time sensitive thing, and if this then afterwards we say look into PrEP and see, so then you won't have these kind of chaotic emergencies. So that would be the follow-up. But that's kind of the comprehensive HIV testing experience. We would, before COVID, we would also have our mobile testing unit, and that we would also have our staff and our peer educators that would go out, do either street outreach. We would be like, let's say in the Junction Boulevard, where it's a high trafficked area, and people would come in, get tested for free, and move about their day. And we would go throughout all of Queens, and sometimes we'd be asked to go to the other boroughs as well. But that's where we were able to educate and outreach to the community in Queens.
You had mentioned a little bit of paperwork. If people are a little bit more fearful and want some anonymity, is anonymous testing available?
Not anonymous, but we have to, we will just do it. It's confidential. Everything stays confidential.
Confidential and
within us.
medical privacy laws, so your information is secure.
Absolutely, yeah. HIV information is one of the highest confidential paperwork, if you will, that has to be. The laws of it are very strict, along with like mental health information.
But somebody concerned about their privacy should not be concerned because privacy is protected.
Absolutely, yes,
Okay.
yes.
That was a long-winded way of getting to that point.
Yes, of course, and yes, everything. There's different measures that we'll take. Everything is like, for example, here our information is kept in one storage. If we are using paper, it's kept in a locked room, locked storage. And then the office is locked itself, and that's part of what our contracts. We have to maintain all of our information with like 3 barriers at least of confidentiality.
So somebody comes in for testing and the result is positive. How are they guided into a program of maintaining their health?
Sure. So as we are an affiliate of the AIDS Healthcare Foundation, which they provide the clinical aspect of our work. So they will get tested, positive results. We will end up linking them immediately to the medical clinic, and they can get a free Uber ride if they would like to take by car and they don't want to take public transportation, and that's paid for. And we would have someone like Alejandro, who is our care navigator, one of our care navigators, who that's one of his main jobs here, is to make that person feel comfortable, tell them, it's okay, I'm here for you. We're going to go to the clinic together if the client, of course, wants to. Most of the time they always do, to be that comfort. So Alejandro will go and accompany them to the clinic and make sure that they're connected with ADAP, which is a program that helps out to pay for the medication, and make sure that they get their medical care, and at the same time also identify what other social services that client may need.
So
and
it thoroughly ties in with ACQC's other programs. So it's really a one-stop shop for anything that you might need. And I want to remind the audience that on the ACQC.org website, I believe at the top right, there's a little donate button, because the services that are provided to the community to their benefit does cost money, and then a lot of that money is through donations. So donations are essential. So I urge anybody who has a little bit of extra to help out as best they can, whether financially or by volunteering. So I do continue to encourage people to do that. Are there any other major programs that we kind of skimmed over, or we really should go into more detail on?
I would say, I think one of our new programs where we're trying to get, well, I would say too, I would like to further mention is well, maybe Juliana can speak a little bit about this, but we started last year our first summer camp with the youth. And that was a combination of everything that Juliana and IKEA have mentioned, because with youth, it's not we can't just talk about the sexual part, and sometimes it can get boring in a way, because if it's too much like a lecture. But that is, the way I see it is, that's kind of like the end result of everything else that you talk about healthy decision making, about just healthy relationships, being proud, being responsible, which is the name of one of the interventions that Juliana mentioned. And all of that comes into, why should I even care about what you're saying about HIV or STIs? And so it's all of that relationship building with someone else and within yourself. So with that summer camp, that's exactly what we did. We had a day to talk about self-care, building goals. And I should mention, we also did it this year as well, and I think it's still going on. We're on our last week, I believe. Self-care and about more like civic engagement. And something else that we have introduced, we have now partnered with another local organization called Bricks for Kids, and they focus on STEM, on the STEM field. And this is this workshop will give the youth another area to focus on. Right now, this whole summer, it's just been this Zoom. You're just on the computer. With this program, they now have, they're able to come and pick up their robotics kit, and they'll be able to go home and they can follow along with the class that's provided, or the instructor from Bricks for Kids, and they can actually do something with their hands. It's a much more interactive way. And then the parent can also be involved, which then that tends to build a relationship. They're not talking about anything like taboo, or parents that they may be sensitive to, like, talking about any kind of relationship or any kind of like sexual relationship, education. That can be a little bit awkward, but that whole bonding situation, we are hoping for it to lead to better conversations. Like Juliana has mentioned before about the parents, like, how do you talk to your parent? How do you talk to your kids? And it's about, well, you have to first build that relationship to even get to that subject, that very sensitive subject. So we're trying a different way, and we know that STEM in general, it's a very important field for all kids, and especially girls, that at a certain age they tend to be not encouraged as much as boys. So this summer camp is, I think it's phenomenal. The staff have done such an amazing job, and this is just our second year, and we have already gotten so much calls and parents and kids wanting to join, but we only had limited amount of kids. But that would hopefully push us to do more later on, and maybe offer it more often. The second aspect I wanted to mention is, we kind of touched upon it, but not exactly on it, is the importance to discuss about what is U equals U. And if someone has not heard of what U equals U is, it stands for undetectable equals untransmittable. So that is the ultimate result of why we do everything that we do here, and why anyone works in HIV prevention. And the reason for that, it's when someone becomes undetectable, that means that their HIV, the amount of HIV that's in your body is so low that you cannot transmit it. It's just null. So we want, and the way to get to that viral suppression is being very strict on your medication. You have to be, take care of yourself. And this new discovery, that there's been plenty of studies, and I would be more than happy to send you to send you the link to be able to share with the public the links where it talks about these studies, where it's now a light at the end of the tunnel. People who have, who've been diagnosed with HIV, part of the problem that we have seen is, of people being medically adherent is, well, I'll take it, whatever, but not some have not been able to reach that level and to see that, wow, I am not a burden, or I'm not, no one needs to be scared of me anymore, or I am not scared to hurt anybody. And so this is, I think it's absolutely, maybe, I don't know if we don't talk about it enough in public, within our field we do, but in public, and to say there is a light at the end of the tunnel. You know, just be on your medication, stay healthy, and do however, you know, whatever you can to have a better life, and you're going to get to that.
But knowing that information has got to be such a relief on the mental health aspect of everything as well.
Absolutely, absolutely. And so that is part of it, you know, and we need all of these other supportive factors, like having healthy decision making, healthy relationships. It's all a combination. We can't just do, you know, looking at it in silos. Everything has to be together. So being self-care, healthy relationships, being healthy, staying healthy, and being very strict with your medication and your regimen, having a good relationship with your provider, it's essential. So I wanted to just bring those things up.
Right, and regular visits to your doctor to make sure that you remain undetectable, because I have a few friends who've had little blips, say they had the flu, and then they slide into slight detectability. So you need to follow up and make sure that not only that you would adhere, but the occasional blip that pops up, you get it under control as quickly as possible.
Absolutely.
One thing that we kind of skimmed around and we really didn't talk to specifically was, is there any different approaches to outreach for the trans community? I mean, trans men and women are coming out younger and younger these days, and or even along the non-binary portion. Is there a different way to approach that sort of outreach?
Yeah, I was just going to say, I think the best people to answer this is with Juliana and IKEA, because our drop-in center and most of our and the groups that IKEA works with, it's all the LGBT plus community. So we have and also our drop-in center, I think most of our, at least half of our clients that have enrolled have been female trans males. So
Akita, if you want to address that.
We actually don't have too many, I would say, trans identifying youth. They're more so bisexual. We may have some gay men that come in, well, boys rather. But for the most part, there hasn't been too much of a trans community out in Far Rockaway, because that's that area. There aren't a lot of people who are out in terms of like them being open about their sexuality in that sense. So I would say it's more so anyone who's maybe bisexual or gay males, but not too many of the trans community.
Okay, but all are welcome, obviously.
Say it again?
All are welcome, obviously.
Oh yes, of course, absolutely. Yeah. Absolutely, yeah. We make that very clear that, you know, it's open to everyone. It's not just an LGBT group; it's a youth group. So anyone who falls in the age category is welcome.
Okay.
Yeah, we do have some trans women specifically who do come to our drop-in center. As IKEA mentioned, as you also mentioned, all are very welcome. We also have some youth who are in that confusing period when they're not sure if they're bisexual, if they are gay, or if they're still going through that process of finding out their sexuality and their expression, their gender expression, and we are here to help, right? So they come in, they get to talk to other people who have gone through the same journey. It's a safe space where, unfortunately, some of them are facing homelessness or they are at risk of facing homelessness. So this is a place where they can come in, they can not only get services, but they can also talk to their peers and help navigate this new phase of their lives.
Okay. That's good. And We talked about, we went into U equals U, but there are people who are in zero discordant relationships as well, and that can bring about a little bit of anxiety. So if somebody who is negative is looking to possibly dating somebody who is positive, you can arm them with the information that can put their mind at ease and teach them how to best protect themselves as well. So,
Yeah.
okay, I guess I just answered the question. But okay, so basically, yes.
And John, I just wanted to mention as well, one of the things that has changed a lot right now is our larger at ACQC. We have had for a number of years a transgender group that meets, that they would meet here every Friday. And unfortunately, because it was like almost like 30 people who would be here every Friday, that program is no longer able to meet here. But that was a very, very important group that this was almost like that group almost became a family.
Mhm.
And they would have just educational sessions every Friday. And a lot were also from different countries, mainly all Latin America, I would say, like about 90%, I would safely say. And this is, because it came from, it became a family because they either were ostracized or just pushed out, death threats in their own country and came here. And so it's a very crucial population. And we also partner with the Trans Latina Network to more education and provide just more support to the very, I would say, vulnerable population and very high risk, unfortunately.
Okay. I think we covered quite a bit, and I'm grateful for everyone who's taking part with this, and I respect and appreciate the hard work that you do, and I know all the good that you're putting out into the community is going to come back to you in life tenfold, I'm sure. So thank you so much for everything that you do. Where can people find out more information again? The phone number is?
Yes, I will. I could tell you the phone number, and for some reason I don't know why we have like the 3 phone numbers that from our Woodside. I will give you our Woodside phone because that is the phone number that you can call for testing. And so the phone number is 718-472-9400.
Okay.
And
And the
you will be-
website is acqc.org.
Yes.
Okay.
Yes, absolutely. And also
And
really,
oh, go ahead.
yeah, a great
I was
way.
going to give the Jamaica number.
Oh, yes. But you can call the Woodside and then you will be connected to all of the sites either way. So, and another way to get information very fast and the most up to date is through our social media. So everyone almost has a different social media because we cater to the different populations. And all 3, Ikea, Juliana, and Alejandra, each run their Facebook or Instagram pages as well. So it's a long list. I can share it with you.
Well, if people call up or if people start to get involved with the programs, I'm sure they can find it, or even a quick search will lead them to it. So
yeah, absolutely.
rather than just throw out websites, let's just say acqc.org and the phone number that we just said, and all the information is there and available, and all of your services are there and available. Again, I want to implore people to help out as much as they can by providing either time or that little bit of extra jingling money goes a long way to providing services. So please donate as you're able, because again, there's so much to offer at ACQC, and in the education and prevention programs. especially it's the foundation for so many people's physical and mental health as they're coming of age and becoming more aware of what's going on out there and what's going on within their own bodies. So I'm very grateful again to all of you for taking the time today to chat with me, and please continue to keep up the good work. ACQC.org, and we've done a bunch of stuff with ACQC on this show that's available on our YouTube page. The URL talkingabout.info will take you right to our YouTube page, and you can see all the shows that we've done with ACQC throughout the years, and plus a whole bunch of other stuff as well. So I hope you take the time to do that again. Thank you everybody for taking the time. I'm John Griffith, and I will see you next time.
Thank you very much.
Thank you.
Thank you.